So I have the great pleasure to welcome Zhao Liqin, or Liqin Zhao, who's very kindly offered to come and give us a talk to help us celebrate integration. For those of you who don't know, Liqin Zhao is the president of the ATCM, and we thought it would be interesting to talk about the ways in which acupuncture is a flexible method of treatment blends in with Western medical treatment, and a key area obviously for that is in infertility. So I hope you all enjoy the talk, and over to you.
Shall I share my screen first?
Yes, please. Yeah.
Thank you. Can you see it?
Yes, we can. Yes.
All right. Okay. Good morning, everyone. Thank you very much for, well, especially to invite me to joining the conference together with all the colleagues, so to celebrate our profession. So I'm very grateful that we can use this new platform, Zoom, to share our experience or discuss things about our profession. So first of all, I like to wish the conference a great success on behalf of ATCM. Although I've been a member of BACC for over 20 years, so I hope and I believe we will continue work together in an even better way in the future to promote our profession, acupuncture and Chinese medicine. So today I'm going to share with all the colleagues about what I've been doing, so which again is celebrating the integration of acupuncture, Chinese medicine and IVF. So as some colleagues might know, most colleagues might not know that I basically specialize with infertility. So I've been doing this for many years. So basically I graduated in 1985 and came to this country in 1995, which is actually 10 years later. And I established my clinic, which is called Zhongjing TCM. So I am the president of ATCM. So I'm grateful that, again, BACC and ATCM have been working together for many years to promote our profession. So today, basically, I'm going to go through those, well, 8 items together. Due to time issues, we just have to briefly introduce everything, or I will share everything with you all. As you probably all know, the infertility problem is a very, obviously, a common and complicated case. And there are about 1 in 6 couples having this problem in the UK. Which most of the couples would seek what is called IVF rather than turning to acupuncture or Chinese medicine. However, the IVF average success rate is still very low. It's about 29% for women under age 35. This is the very latest figures I have. And of course, for the lady over 35, this figure will dramatically reduce even further. So the good thing is there are some researches reported that acupuncture can improve ovarian function, and the response to IVF drugs, and also to reduce the side effect of IVF drugs, and also enhance the quality of the eggs and the implantation. So therefore, increase the success rate of IVF. So this is what I've been doing, and it definitely proved this worked very well for those patients. So in the UK, well, I just basically want to give you a little bit figure about our acupuncture development in the worldwide. You probably know even better than I do, but anyway, from what I know in the UK, about 7% of the adult population have visited acupuncturists within their lifetime, while fertility problem is the second most common health condition following pain-related conditions for which people seek acupuncture in the UK. So this was published on the British Medical Journal in 2012. However, when I just came to this country in 1995, at the time, there were not many patients coming to see me for fertility issues, which what I mean is I don't think at the time there were that many patients even know acupuncture or Chinese medicine can help fertility issues. More people probably coming for skin disease, headache, migraine, depression, or arthritis, pain-related problems. While nowadays, loads of patients coming for fertility problems, which is good that they know there is an option for them, that we can help them apart from just IVF. So since 2002, which after the German study about acupuncture in assisted reproduction or IVF, are really become very popular. Now I'm just going to share with you some research reviews briefly. The first research study the effect of acupuncture in improving IVF outcome was done in 2002. As I said, it was in Germany by Paul's team. This study, they did have 160 patients, and which 80 was selected randomly to the acupuncture group, while another 80 was in a control group. What they did was basically acupuncture on the day of embryo transfer, 25 minutes before and 25 minutes before and straight after the transfer as well, and also with some auricular acupuncture, which is the ear points. So the points they used are those ones. I believe some colleagues probably already know this, so I'm not going to go through all the details. But anyway, the good thing is the results which revealed that pregnancy rate was significantly higher in the acupuncture group than in the control group, which was 42.5% vs 26.3%. So which is a big difference, even though those studies are probably not quite designed properly, because I only did acupuncture on the day of transfer, so it cannot really reflect the effectiveness of acupuncture. What I'm saying, we could increase the success rate even further if they did it properly. So, but the good thing is at least showing a good positive result. So that's why there are more and more patients come to us for helping fertility issues or to support IVF. So since then, there are another over 10 more RCT have been carried out, and 7 of them similar acupuncture protocols as Paula's, and there are some others they did slightly different. probably an extra acupuncture sessions in a different day. And anyway, the conclusion from this meta-analysis of over 10 RCT revealed the pregnancy rate for IVF is significantly increased when acupuncture is administered on the day of embryo transfer. Again, it's not just one study, but there are more studies than that. And actually the latest one was published online on the 29th of March last year. It was, it's International Journal of Reproductive Biomedicine. So this time what they did, they got the 186 participants were randomly divided into 3 groups rather than 2 groups. So one group, basically they had acupuncture 25 minutes before embryo transfer, while in the group 2, they had acupuncture 25 minutes before ET and also straight after transfer. And another control group, they basically just had acupuncture. Sorry, they just had a routine IVF procedure. Even on the ET day, they didn't do acupuncture or shame acupuncture. So basically just not any acupuncture. So those are the points they used for those groups, for this study. And then again, the conclusion is acupuncture 25 minutes before ET significantly increased IVF outcomes, but repeated acupuncture 25 minutes after ET did not improve the IVF outcomes. So they basically did it in a different way. But again, I personally don't think this is really good enough design of study to really reflect the effectiveness of the acupuncture. But however, is a very good positive outcome. Then there is a research on TCM and IUI, which this is a very good one, and it is the first study to measure the effectiveness of TCM in combination with IUI. This was published on the Journal of International Medicine on January 2012. So the TCM program was designed to meet each woman's specific needs, acupuncture weekly, and individualize the regime of Chinese medicine. So this is what I've been doing. So basically individualize the protocol or TCM protocol according to their IUI or IVF protocol. So anyway, the average age in the study group was 39.4, which is almost 40 years old, while the control group was 37.1, which is 37 years, so it's 2 years different, even though that the TCM have, the result showing the TCM have a major impact on the success of IUI. 65.5% of test group conceived compared with 39.4% of the control group, even though in the study group, the women are older than the ones in the control group. So which is brilliant. But unfortunately, I didn't see any more those kind of research. I guess it's not easy to do a research like this because we'll be individualize the program. But this is what we should do, I believe. So anyway, now I'm briefly explain to you about the ART or IUI or IVF, because as we try to help our patients or support our patients when they are going through IVF, we need to have some basic knowledge at least about IVF, about IV protocols or IUI, and or the drugs, what they use. So therefore, we could apply our TCM or acupuncture in Chinese medicine in the most appropriate way to help them. If we don't understand anything about IVF or IUI, and then we might use, we might not doing any help. So anyway, as you probably all know, there are many different ways they do to help patients from the hospitals. Ovulation induction, IUI, IVF, embryo transfer, frozen embryo transfer, ICSI, and the new one is called IVM, which is in vitro nutrition. So in the UK, the commonly used IVF protocols are below. Of course, according to different clinics or fertility centers, they might have different protocols, and especially for those women who have more complicated conditions. For example, they might have immunological problems, they might have blood clotting disorders, they might have some other issues. Therefore, they would probably need more different or extra drugs than just this standard protocols. But again, due to time issue, we can't explain everything here in this one session. So the commonly used one is antagonist regime, another one is agonist regime, which there are 3 different ones, long protocol, short protocol, and ultra long protocol. This is what is a standard or typical IVF cycle, what is like, and how much the ladies or the couples need going through, which is very stressful. But unfortunately, there are some patients, they have issues that they have to go for IVF, or for some of them, they might actually not quite need IVF yet, which what I mean is if they know that what TCM or acupuncture Chinese medicine can offer, they could come to us, and then we might save them a lot of money to do the IVF. But again, there are many of them, they don't know, so therefore they would go for IVF if they failed to conceive naturally. But anyway, this is what they need to go through. So the first protocol is called antagonist protocol, so which basically is suitable for women with diminished ovarian reserve or premature ovarian failure. So this protocol will reduce the risk of ovarian hyperstimulation. Colleagues might aware of this, this can be very dangerous. And for the worst case, they say it can be life-threatening. But the main thing is it would affect the outcome of IVF. So anyway, so this is the protocol they designed for people might have the high risk of OHSS. What they do is they use the stimulation drugs from day 3 of the cycle, and then use citrotide or Liqin, which is another name of it, another medication on day 7. So the reason they use this one drug is to suppress the pituitary gland to prevent premature ovulation, because obviously they want to collect the eggs in the right time rather than the egg released by itself. But of course, while they are taking the drugs, the hospital will monitor their hormone levels with the blood test, and also monitoring the egg development or follicle development with the ultrasound scan. So when the eggs are about 18 millimeters, which are about ready to mature, and then they will time it to do the HCG injection 36 hours before the collection. So this is a second one, which is the lung protocol. This is a standard one. So apparently 90% of the IVF cycles, they use this one. So this one, they basically do the downregulation on day 21, and then start stimulation from day 3. So again, why I'm introduce this to our colleagues, as I said earlier, we need to know when we're helping patients going through IVF treatments. So when they are downregulate, what do we need to do? When they are stimulate, what do we need to do? So we need to have a basic information about it. So anyway, the stimulation is from day 3, and then the respite is similar as the antagonist protocol, while the short protocol, which is mainly designed for the poor responders, which means they had IVF treatment in the past, but they didn't respond well and might not produce enough eggs for egg collection, or had egg collection but not fertilized, or poor fertilization. And also for those ones a little bit older, which I saw many of them, they left too late, or they've been trying for so long but unfortunately didn't achieve anything till they are in their 40s. But this one, basically they do the downregulation from the day 2, and then day 2 of the cycle, and then on the day 3 we'll start the stimulation drugs as well. Well, for the lung protocol we introduced earlier is day 21 of previous cycle, start downregulation, and then start stimulation drugs on day 3 of the following cycle. So, but again, respite is similar. And then for the ultra-long protocol, which is designed for the severe endometriosis patients, or another condition which is similar as endometriosis, is, I never pronounce this one properly, is adenomyosis, if I pronounce it correctly. So basically what they do is they will give patients Zoladex or Prostab or other drugs to suppress the patients. So they basically will stop the lady menstruate during this 3 months time. Then after 3 months, they will do the scan for the patients to check if it downregulated well. If everything is calmed down, and then they will start the IVF treatment, which the stimulation drugs. But the dosage of the drugs are different depending on the patient's condition and their age, and if they have any other issues. So, but the respite will be similar. Although IVF is a great thing or very advanced technology to help those women or couple cannot conceive naturally, but there are some potential risk of IVF, which one is multiple pregnancy, which majority of them would be fine, but there are some complications with multiple pregnancies. And again, OHSS, this is one can be very risky and also harmful. And the egg collection, of course, is very invasive procedure. So it's not nice at all. And also, if they did achieve pregnancy, unfortunately, the high risk of a miscarriage, they have a high risk of a miscarriage. So therefore, when we help those patients not to just stop the treatment when they are pregnant, we need to carry on our treatment during the pregnancy as well. And another problem is the risk, which is ectopic pregnancy for those ones. Patients or some probably colleagues as well don't quite understand they think, oh, IVF basically transfer the embryos into the uterus. Why they do get pregnancy, sorry, ectopic pregnancy. But the reason for that, yes, although the embryos transferred back to the uterus, but before it is, or they are implanted, they are still kind of floating in the uterus. It can be anywhere, tubes or ovaries. So therefore, the high risk of ectopic pregnancy of IVF is very common. Right. So now this is our TCM understanding of those drugs. The downregulation drugs, basically the side effect, popular or common side effect is headache, hot flashes, breast tenderness, and quite moody, irritable, and all those, and can have really bad insomnia, which in turn our TCM is kidney yin deficiency with qi in the blood stagnation. While the stimulation drugs, those ones are commonly used. So the side effects of these drugs are fatigue and dizziness, and can cause nausea as well. And some of them might get really bad sickness, and the abdominal bloatedness is very common, and again OHSS, and also can be very emotional. So which basically is spleen qi deficiency, and together with the accumulation of dampness. While the pregnal, which is HCG to induce ovulation. This is just temporary really, but I just need to be aware that patients might have this kind of problems, like one of the common one is headache, and they can be very irritable as well. So this basically is excessive yang rising. But as I said, it's only temporary. We don't really have to do much about it unless they suffer really badly. Then we can use acupuncture to help them, which is very effective. While often the patients will have progesterone, common one is these two, Utrogestin or Cyclogest pessaries, to assist in the implantation. And there are some ladies, they might need injection as well as pessaries. Normally those ones are having problems with progesterone production normally. For example, if they have a luteal phase defect, they might need extra drugs to support the implantation. And so again, the side effect can be bad, skin irritation and sore tender breasts, and very, very tired. And also again, some of them might have abdominal pain or constipation badly. So this is basically kidney yang rising, and also the blood, yin and the blood depletion, which is deficiency. So now we will just briefly discuss about our TCM, which acupuncture and Chinese medicine, to help the patients who are going to have IVF treatment. So before they start IVF, I would normally advise them to start treatment 2 or 3 months beforehand, depending on what their condition is, to treat their primary cause, which what we call using our TCM pattern differentiation and combine the menstrual cycle therapy. And again, due to time issue, I'm not going to go through in detail, but I think I want to make sure that our colleagues are aware, and I'm sure you do. This is very important, rather than just to do acupuncture or Chinese medicine when they starting IVF treatment, to really help them to maximize their chances. Preparation rather important. So the three months of preparation is trying to restore the adequate balance of energies, which is yin and the yang, qi and the blood, and regulate the functions of organs, and to improve the eggs quality, and the endometrial lining, the endometrial receptivity, and therefore they can produce the best possible response to the IVF drugs, and of course enhance the chance of conception. In fact, during this 3 months preparation, there are some patients that they might fall pregnant naturally, which is great. So there are many of the patients surprised their IVF doctors or consultant I'm not sure they are happy about this, the IVF clinics I'm in. But anyway, I don't care what we do. We are trying to do help our patients, whether conceive naturally or combine with IVF. Briefly introduce the psychotherapy. So as we know, different energy dominate different phase of the menstrual cycle. The phase 1, which is called the yin phase, is between day 5 to 12 of the cycle. This is based on a 28-day cycle. If the lady have a longer cycle or shorter cycle, we need adjust this. So the yin phase, which is follicular phase, in terms of our acupuncture in Chinese medicine, the kidney yin or kidney jing or essence and the blood governing this yin phase. So therefore we need nourishing the kidney yin, tonify the blood and the qi to support the estrogen. And also we need to improve the egg quality. Again, this is very, very important because IVF drugs only make the patient to produce more eggs if they respond to the drugs, but they cannot do anything to improve the eggs quality. So, but this is what we could do. It does really help. So again, by doing this, can also enhance the endometrial lining, which to make it nice and thick, and what we call the nice cozy environment in the uterus. So therefore, prepare the best foundation of the conception. So I always explain to them it's like the soil in the pot. For the plant to grow, the soil need be really healthy. Otherwise, even you bought a plant very healthy, but the soil in the pot is not good enough and the plant might not survive and therefore failed. So the herbal formulas, popular herbal formulas we use, which is 八珍散 with 六味 地黄散 or 六味地黄丸 or 左归丸. Why I said san, which means like a granules or powders, because we are not allowed to use these patent herbs in this country. However, this is a popular formulas I would use. However, I do have my own self-prepared herbal prescription, which is called 养精玉卵散. So the main ingredients are 当归、白芍、熟地、白术、山药、山茱萸、黄精、女贞子、枸杞子、桑葚子、菟丝子. Due to time issue, so I'm not explain everything here. But if you do like to know more, you can contact me later. But we focus on acupuncture. So the acupuncture points I would normally use in this stage is 220 PC6, large intestine 4, Ren 4, 子宫, stomach 29, 30, stomach 36, and spleen 6, kidney 3, kidney 7, and urine blood 20 and 23, which is 脾虚 and 肾虚. The phase 2, which is ovulation phase, this is normally between day 13 to 15, again, based on a 28-day cycle. This stage is a process of yin and yang transformation. So the liver qi and the blood flow control the ovulation. So the liver qi is triggered to begin the transformation of yin energy, which is estrogen, into the yang energy, which is progesterone. So we need to nourishing the kidney yin and also the meantime to strengthening the kidney yang to support this transformation. So we need soothing the liver qi and activating the blood to promote ovulation. So this is very important. So the common herbal formula is 桃红四乌汤 or 四乌丸, 柴胡疏肝散. Again, I have my own prescription, which I name it 养血疏肝促排散. So the main ingredients are 丹参、当归、白芍、赤芍、柴胡、虫味子, etc. There are about 13 different ingredients. And while the acupuncture points we use are Ren 3, stomach 29, 子宫, and large intestine 4, spleen 10, and stomach 36, and spleen 6, and the liver 3. So for the phase 3, which is a young phase, is between day 16 to 25. So this phase is called the luteal phase. The kidney yang and the spleen qi dominate this young phase. So therefore, we need to work on the kidney yang and the spleen qi to support the progesterone. And also we need nourishing the blood to enhance the endometrial lining. So therefore, the egg can be fertilized and then implanted. And the common herbal formula is called 右归散 or 右归丸 and 从容补肾散. Again, I have my own prescription, is called 补肾助孕散. Again, about 15 different herbal ingredients. The acupuncture points, the main points I normally use is 220, PC6, stomach 36, and the spleen 10, spleen 6 and the kidney 7, liver 3, and the urine blood 20 and 23. So the phase 5 is premenstrual phase is day 26 and 28. So liver qi is help menstrual transformation and converts yang energy into yin energy. So to harmonize, what we need to do is harmonize the liver qi and activate the blood and to unblock the channels to regulate the period. So the herbal formula, I'm sure colleagues probably all aware, which is 逍遥散 and 调经补血丸 or 调经补血散. The main points we use is 印堂 large intestine 4, PC6, 10, spleen 10, spleen 8, and spleen 6, and also liver 3. And the phase 4 is the menstrual phase, so we don't really need to do awful lot this stage. However, for those ones, if they do have really painful clotty period, or if they have a very light period, we might need do some acupuncture to help them as well. Right, now acupuncture during the IVF treatment. So I do have the individualized acupuncture and Chinese medicine plans or program. Due to the downregulation, which is 2 to 4 weeks prior to ovarian stimulation. Again, depending on patients, what the protocol they use, their IVF protocols they use. It could be 2 weeks, it could be 4 weeks, it could be longer, like the ultra long protocol, that be 3 months. So anyway, this stage, what we need to do is soothing the liver qi and strengthening the spleen and harmonize the qi in the blood. So the acupuncture points we use, I normally use would be 印堂, large intestine 11 and 4, and also PC6 and spleen 10, liver 3, spleen 6 and kidney 3, and also the back shoe point, urine blood 18, 20, and 23. While the herbs, we can use 逍遥散, 柴胡疏肝散. While during the hormonal stimulation stage, which is normally day 2 or day 3 of a menstrual cycle, they start these drugs until the egg collection. This stage, we need strengthening the kidney yin and kidney jing, and also the spleen qi, and also tonify the qi and nourishing the blood. So the point we use is 220 yin tang and ren 4 zigong, spleen 10, stomach 36, and spleen 6, liver 3, kidney 3, urine blood 18, 20, and 23. The herbs I have, again, is my own prescription, is called Yang Jing Yu Luan San, which is mainly main ingredients are 山药、山茱萸、白术、茯苓、女贞子、桑葚子、枸杞子、菟丝子, about 15 different ingredients basically. Between egg collection and embryo transfer, this stage is very, very difficult for the patients, because after collection, they are waiting for the clinic to call how many fertilized, how many divided. So it's extremely stressful, which they often call is a roller coaster. So we need to harmonize the liver qi and the blood, and also to nourishing their hearts, to calm down their spirit, which calm their shen, as well as the uterus, because after the collection, it's kind of like quite messy inside of the pelvic. So we need to do acupuncture to calm them physically and mentally. So the main point I would choose is 四神聪, do 20 yin tang, PC6, large intestine 4, and stomach 25. I might not going through all this, so you can see on the screen anyway. It's just time is not allowed to say too much. And also I would combine the acupuncture, the points on the ear. Popular one is 脑点, 神门, liver, spleen, and kidney. We don't need to use all of those points. We can choose probably 2 of them or 3 of them. And again, I have my own prescription, which is called Yang Xue An Gong San. It's basically to tonify the blood, as well as, to nourishing the blood, as well to calm down the uterus. And so on the day of embryo transfer, which we did talk about earlier, there are some—
Zhao Liqin, sorry. We just got to keep an eye on the time. I'm sorry about this.
Oh, yeah, so, sorry.
I know you've got some case studies.
Yeah.
We can put up the slides so you can maybe miss the case studies, and hopefully we'll give a little bit of time for people to ask questions, if that's all right.
Okay, thank you. Sorry about that.
Okay, that's
I'm not very good with timing.
Okay.
Yeah, okay, I will try to be quick. So on the day of transfer, basically, we need to nourishing the heart blood to calm the shen and strengthen the spleen qi to hold the embryos in the uterus, which means trying to help and prepare for the implantation. So we'll do the 2 sessions of acupuncture, 30 to 45 minutes before and straight after. And those are the points I would use on the day of transfer. So you can see on the screen. And then after the embryo transfer and during the early pregnancy, again, this is the stage we need to carry on the treatment, but we need to work on the kidney and the spleen, and also nourishing the qi in the blood. And again, we always need to work on the uterus, blood supply to the uterus, as well as to calm the uterus. So therefore, to supporting the implantation. And so a discussion, basically, IVF is a very complicated case. So we need to help them mentally as well as physically. So it's often the case of a mixture of deficiency and excessive condition. And so the preparation is very important, as I said, and also good timing of treatment. So we need to use a different treatment, acupuncture or Chinese medicine protocol or plan according to the IVF protocol. And a healthy diet and lifestyle is also very important. And also we need to have a good relationship, so can talk through everything with the patients, or they can trust us and then we can help them. And also, again, continue the treatment is very important during the early pregnancy to prevent the potential miscarriages. Summary, which I think you can see, basically we already went through, so we can do awful lot to support the IVF treatment. So case study, if we don't have time, that we probably leave it. Shall I just go through one case study? Do we have enough time or not? Otherwise, we'll leave it.
If you could leave it, actually. So yeah. I think because we are at the time, yeah. I know it's quite difficult when you get interrupted, but if I remember, do you have like a summary towards the very end? So if you just...
That's a summary.
Yeah, so maybe if you just go over that, and hopefully, well, if somebody wants to ask a question, if they could just start typing now, or put their virtual hands up. That's the yellow. Okay.
Sure. Yeah. So basically, this just to summarize how acupuncture and Chinese medicine can improve the IVF outcome. So basically, we can do the preparation before IVF to support the patients physically and mentally, and also can elevate the tension during this stressful process, which they all have, and reduces the side effect caused by the IVF drugs, and to improve the response to hormonal stimulations, especially for those ones who had a poor response in the past. And again, to increase the blood flow to the uterus and the ovaries, and to enhance the egg quality and also the endometrial lining, and therefore create the best possible environment in the womb for conception. And also to calm the uterus to prepare for implantation, and to maintain a healthy pregnancy if successful, and minimize the risk of miscarriage. So this is what and how much we could do. So the outcome is tremendously different, or in other words, is very positive. So I'm sure all the colleagues probably did help some IVF patients. So we can really offer a lot. Thank you very much. I'm really sorry. I did prepare that might not have time to go through the case studies. Thank you, Yin.
No, thank you very much. So a number of questions have come in. Some are asking about the slides. I'm pretty sure we'll be able to make those available to everybody. Some other questions are probably more than a whole presentation in themselves, one about male infertility, so we won't be enough time to answer that. But there was one that was just quite specific, is there any research that acupuncture improves egg quality? So I'm not sure whether that research is available.
Egg quality, the research, there are some research, not particularly just for the egg quality. Well, sorry, in China, there are some studies they've done for this egg quality wise, but in the Western country, shall we say, that most of the studies they've done is more for improve the IVF outcome.
Yeah.
And also there are studies to find out if acupuncture does help or improve the live birth rate.
Yeah.
Yeah.
And just one question, do you treat the partner to enhance the sperm at the same time?
Yes, I normally do ask patients to come together as a couple, the first initial consultation. If the husband, the partner has issue, I will treat both.
Okay. All right. Well, unfortunately, I think that's all we have time for today. But once again, thank you very, very much for joining us today. It's been very interesting.
Thank you. Great pleasure. Thank you very much.